Now, the father of a young man who drowned after walking out of the mental health unit at Waikato Hospital unsupervised says his care was a train wreck waiting to happen. Nicky Stevens, who was 21 and suffered from schizophrenia, died in the Waikato River in March 2015. His inquest ended in Hamilton today, and our reporter Andrew McRae has been there.
Nicky Stevens' father, Dave McPherson, told the inquest the family had been closely involved in the various stages of his son's care, and they thought he was in the best place to receive treatment. However, Mr McPherson says, sadly, the family's experience with Waikato DHB's mental health services removed all trust they once had in the system. He told the coroner that granting of unescorted leave placed his son in danger, especially as he had tried to kill himself at least once. Mr McPherson says clinicians ignored the family's request for only escorted leave breaks.
The hospital has an absolute duty of care to see that he does not come to harm, and letting him out unescorted at this time is a total abrogation of that duty of care.
He says red flags about care at the hospital were raised when his son had earlier tried to take his own life.
When we found out Nicky had been admitted to hospital with a serious suicide attempt requiring urgent surgery that took 5 hours, we were told, having all of that happen and us not hearing about any of it for 3 days.
Mr McPherson told the coroner the family went to the police to lay a complaint because they felt the DHB had handled the situation badly. The police considered provisions in the Crimes Act around culpable homicide, but they didn't pursue it further. Mr McPherson says they only ever wanted the DHB held responsible, not any individual clinicians.
We were very unhappy about some of the decisions by individual staff members. They'd been badly wrong, but more importantly, we felt it was a DHB responsibility.
A hospital psychiatrist who was Nicky Stevens' lead carer in the days leading up to his death earlier told the inquest that Mr Stevens had told staff he didn't want his parents involved in discussions around his care. Nicky's mother, Jane Stevens, who was back in the witness box today, disputes this. She says while Nicky, after trying to kill himself, had told emergency department staff that he wanted to tell his parents first about what had happened. At no other stage did he want them excluded from decisions around his care.
What I have experienced is that seems to have continued through, at least in the conversation with clinicians, that therefore meant that Nicky didn't want us involved. I have reviewed the clinical notes and there are more comments about Nicky's engagement with his family, about him wanting to involve his family.
Jane Stevens says both the whānau and clinicians all had her son's best interests at heart, but they both had different opinions on how it was to be achieved. She says what she wants to come out of the tragedy is a much stronger collaborative relationship between clinicians and families of mental health patients.
There wasn't that collaborative relationship, even though it existed within DHB policy at the time. On the ground, it wasn't operating, and certainly some of the recommendations that I've made to the coroner address those issues. We want to see things go forward in a positive way.
The inquest is now ended and Coroner Wallace Bain has reserved his decision. In Hamilton for Checkpoint, Ko Andrew McRae tēnei.
And if you do have concerns about that, or you do want help, of course, Lifeline is always there on the phone. You can call them 24/7, 0800 Lifeline. You can also text HELP immediately from your phone if you'd like to speak to someone about those issues.